So joining us now from the West Coast, Dr. Niranjan Bhat, Senior Medical Officer at PATH.
Good afternoon, everyone, and again, thank you for your willingness to have me on your panel. It's an honor to speak with you. Just a little bit of background about PATH. Mateen had talked about that a little bit in his remarks, but PATH is a nonprofit that aims to advance health equity through innovation as well as partnerships with various actors across the public and private sectors. And we do this through both research as well as implementation support. And while the latter, implementation support, is mainly supporting governments in adopting and scaling technologies and interventions or strengthening and refining systems, health systems, et cetera, the former part, the research, includes development of new technologies, whether it's vaccines, drugs, diagnostics, digital health. And we also research into the use and impact of those interventions once they are implemented. And this takes the form of early to late stage clinical trials, observational clinical or epidemiological studies, as well as qualitative or social behavioral research. And so we sort of sit in the middle as a connector or a facilitator, connecting funders, researchers, manufacturers, laboratories, governments, NGOs, global public health community to get this research done. And since we're a nonprofit funded mainly by donor organizations, we work with industry, and usually we work with them in exchange for them making some sort of public health commitments. So that's the background for us working in maternal health, maternal immunization. And as for myself, I'm a senior medical officer. I work on various vaccines that reflect the broad range of vaccines at PATH. But in terms of maternal immunization, I first started working in the area about 9 years ago when we collaborated with the WHO on efforts to encourage maternal influenza vaccine immunization in low and middle income countries. But soon after, I started working with a vaccine manufacturer based in Thailand to evaluate a new pertussis vaccine for use in pregnant women. And we just wrapped this up, a clinical trial of a vaccine in about 400 pregnant women and their infants. And I would say the study has been generally successful. We've learned a lot about about the considerations that need to be made with conducting research in maternal with pregnant women. And we've gone on, in addition to pertussis, to work on supporting the development of new vaccines that are specifically designed for use in pregnant women, including RSV, respiratory syncytial virus, and Group B streptococcus. And we in fact, are conducting early stage trials of the latter vaccine. So what is it that we have at PATH that helps enable us to do maternal immunization? The first thing is that PATH has always been focused on underserved populations, and they can be underserved due to socioeconomic reasons. That's primarily it, but it could be because they're a minority population, or in the case of pregnant women, it's because of medical and ethical complexities associated with doing research with them. Therefore, at an early time in the organization, at least for the past 20 years, we've had systems and infrastructure in place that allows us to propose as well as conduct research in these populations without hesitation. Of course, with preparation, of course, but we don't have a culture of hesitation in going into research that involves pregnant women. And so one of the main enablers for this is liability insurance. And this is something that insurance was something that Mateen also discussed. And PATH has an umbrella global product and clinical trial liability insurance. And the key aspect of that is that it's no fault, meaning that we don't have to worry about proving whether the intervention or the study caused the injury or not. This reduces barriers, reduces the threat of litigation. Ultimately, it ensures that the participants get the care that they need, whether it's related to the study or not. We also offer to fund clinical trial insurance for the research site investigators as part of our collaborations with them. And so, in fact, that serves as the primary coverage. which then our global umbrella insurance serves as a secondary coverage. So that really is a key enabler for us. But beyond insurance, we of course need to make sure that the clinical trial meets the range of standards from a scientific and regulatory perspective that apply to all of the research we do, but have special implications for pregnant women or evaluations of pregnant and lactating women. So, we make sure that, in fact, maternal immunization is an important component of our overall strategy in public health because it involves two populations with unaddressed morbidity and mortality. That's pregnant women and neonates. And so we usually, involve the discussion about the need for maternal immunization in all of our clinical development plans, whether we need to include reproductive and toxicology studies before entering into humans to make sure that there's no potential, risk of birth defects or other issues coming about. We also make sure that the funders and the manufacturers understand the implications of doing maternal immunization trials. And so we talk about the reproductive toxicology studies. We talk about the staged progression that needs to happen to finally reach a study in pregnant women. And so all of this has to be discussed with and the expectations managed with our funders as well as our manufacturing partners. All of these studies, of course, go through internal review for scientific merit. This is not, again, specific to maternal immunization, but our staff are all familiar with international standards for regulatory needs as well as general scientific needs. And then we have ethical review. Typically, we have review both at local level in the countries where the research is taking place, as well as at the central level by an IRB based in the United States on behalf of PATH. And so every maternal immunization study is subjected to review within different countries and across different cultures who may have different perceptions of risk and tolerances of risk, whether it's from a true risk-benefit standpoint or really the risk of litigation. And that's actually an interesting point because in the US, we are much more risk averse because litigation is much more a prominent concern for us. And so many times our partners are surprised or unaware of any need for special consideration of doing research in pregnant women. But on the other hand, there are other times where they are also especially careful if there has been a history of exploitation or kind of colonial research that's been done, that may give them special pause, especially if we're looking at a population like pregnant women. The last thing I would mention is just financial. We need to make sure that the funders and the manufacturers are aware of the increased financial burden of maternal immunization studies. They have longer timelines. They have twice the population, really. And then, there may be insurance and other things. So let me stop there and turn it back over to Anna.
Thank you very much.